Welcome to the American Institute of Healthcare Professionals video on crisis intervention versus long-term counseling. And in this particular video, we're going to look at the differences between acute short-term crisis intervention versus the more traditional types of counseling that we see for individuals who go to scheduled appointments and work on various issues in themselves. So when we're looking at acute crisis versus long-term healing, we want to see crisis intervention in a way as what we refer to as psychological first aid. And we will be doing another video on that as well. So when we look at acute crisis or crisis intervention itself, we realize that the person in crisis is facing acute or immediate issues which need to be resolved to restore equilibrium and mobility or coping for that particular individual. Crisis intervention specialists hence look to bond with the person, provide safety, and also assess lethality of the situation that the person is facing. Many times, a crisis intervention specialist will look to provide alternative options to help one's mind open beyond the acute issue or the stressor that is right in front of them. So crisis intervention specialists utilize a triage of focusing on the immediate physical, affective, and the cognitive issues of the person facing crisis. This means they deal with individuals who, in many times, are emotionally imbalanced, cognitively illogical, or physically disturbed. And these types of situations involve on the scene as well as short-term care facilities. Now, in contrast, counseling over time looks at long-term healing. It is healing over time, provided through tested therapies. It involves creating support and finding solution-based strategies to help the person with the particular issue. It furthermore, looks to re-educate the person. Counseling is usually not in an acute emergency situation then. It's usually planned or prearranged, and the person, for the most part, is not in an unstable state, albeit sometimes triggering can occur and a state of crisis can emerge in counseling, but this is not the norm itself. Now, acute crisis doesn't just occur necessarily on the scene, but it sometimes occurs in facilities when individuals are brought in, maybe through the authorities or through emergency services. So these lower tiers of crisis counseling can occur in the immediate intake of an individual. They can also occur through facilities, through various crisis helplines that individuals may call if they're feeling suicidal or so forth. Now, within the facilities themselves, individuals are assessed again upon a triage scale for threat of lethality. And this is one of the most important things to know if the person is suicidal. So there is a lethality scale that is measured and various questions are asked. In more severe cases, more senior technicians may be required. And if a pathology, a mental pathology is in effect, then usually a psychiatrist or a licensed counselor might be needed in these particular cases. Those individuals upon intake that have higher levels of lethality that are assessed or are under the influence of drugs, these individuals sometimes are required to stay longer for observation, whether in a facility, a hospital, or whatever place that they find themselves. For most, the initial intake just though requires basic needs, such as food, water, shelter, information, especially information that helps the person find the appropriate resources they need for their particular problem. In other cases, follow-up is scheduled for support, and then later long-term counseling can be arranged. Due to the rise in cases where individuals in law enforcement or emergency services are facing individuals with mental issues, there has been a intake more of individuals in those fields being trained in crisis intervention, and also having various police departments partner with mental health professional groups that allow shared rides upon situations when a call comes in that is more dealing with mental health. So this partnership, these crisis intervention programs with law enforcement help individuals who are in crisis, who are facing mental defect, that are in distress, instead of being arrested and going to jail, instead being transferred to these types of short-term facilities. And this is a very important part of the war on mental illness that exists, trying to help individuals find the help that they need, because there are so many undocumented, so many untreated individuals that deal with a variety of very lower tier mental issues that can very easily be treatable if the individual received the mental and behavioral health care that they needed. But unfortunately, we see within our nation a growing amount of unstable individuals that are unable to handle crisis. And this leads to an array of issues with various shootings and public displays of dissatisfaction that usually become violent because these issues are not being dealt with at the immediate on the scene level. There are various types of crisis, though, that crisis intervention specialists will face. And this could be a crisis intervention specialist that is a licensed counselor, or one that is a lower technician, or one that is in chaplaincy. And these individuals will usually face true threats. They will really face dangers that are not only a matter of helping an individual find some sort of calmness and stability, but also facing a threat of an individual harming themselves, harming others, or even a crisis specialist facing a threat to their own particular life. So having to deal with these affective, cognitive, or physical distresses can lead to some real threats because of the acute situation. So individuals that they might deal with might be facing a particular mental illness. And in these cases, the individuals could be suicidal, facing addiction, be dealing with border personality disorders, where they're very much affected in their ability to emotionally be stable. Or they could be dealing with individuals with schizophrenia or some type of psychosis. And because of this, these individuals can be very erratic, dangerous, and imposing. And they might not respect various boundaries, and their behaviors could be very erratic and sometimes very dangerous. And if we realize that these individuals are dealing with mental illness or dealing with an interpersonal distress that has set them off balance, or they're facing an environmental crisis such as a destruction of their home, fire or earthquake or hurricane, then these types of situations can and do create real dangers for everyone at the scene in terms of how individuals will respond. So it's important for counselors in acute care as well as long-term care to be able to safely be able to help individuals in crisis or trans crisis, to be able to meet the needs of these individuals, and to understand when these needs become demands or threats that can become potentially dangerous for them. And this is why boundaries and rules are very crucial, especially in longer term care when crisis does emerge in itself. So below is our crisis intervention specialist program. There's a link Our phone number is 330-652-7776, and our email is info@aihcp.org. Our resource is the James textbook, Crisis Intervention and Strategies. It's an excellent textbook to review if you are entering into the field of crisis intervention. I'd like to thank you for listening and have a good day.